Heel pain is the most common problem seen in podiatry practices across the United States today. But most people will come in and say, "Doc, I've got plantar fasciitis, but I've read all these things on the internet and I'm still not getting any better." Why is that? Well, most patients that come in have had pain in their heel, and it's sometimes sharp and stabbing, and it occurs usually when they first get up in the morning, and then gets a little bit better after 8 to 10 steps, but then keeps rapidly recurring throughout the day to the point where it's severely painful at times. Why don't they see the doctor? Well, you know, we're so busy. We have so many other things to do. We're taking care of our families, we're taking care of our jobs, so we usually wait. How long do we wait? Well, the average patient waits somewhere between 4 and 6 months and spends more than $250 on stuff to shove in their shoes before they come in to see the podiatrist. When they do come in, oftentimes they really don't have plantar fasciitis. Did I just say that? They don't have plantar fasciitis? Really? Well, plantar fasciitis is an acute inflammatory response, which means that you did something too soon, too fast, you had some repetitive stress, and you started to actually injure or tear the plantar fascia. So picture, if you will, the plantar fascia, which is the ligament that holds up your arch, starts to pull away from the heel bone. As it starts to pull away, you get an inflammatory response. That inflammatory response continues and it becomes painful. So why am I saying that most people don't have that? Well, after 4 to 6 months of having plantar fasciitis, you get what's called plantar fasciosis. Not something you usually hear about because most people don't understand it. Plantar fasciosis is actually a chronic degeneration of the plantar fascia. This is when there's actually an absence of inflammation. What do I mean by that? I mean that your body's mechanism to try to fix the injury has actually given up. And so at that point, it's really a different animal than plantar fasciitis. Now, most people, when they do come in, 4, 6 months later, maybe 2 years later, they're still in pain, and they come in, "Doc, fix me." They want me to wave my magic wand. I have one, but it usually doesn't work very well for this. So we sit there and go, well, do they truly have plantar fasciitis or is it plantar fasciosis? Most times, when you've had pain more than 6 months, it is plantar fasciosis. So what do? Well, we have a very stepwise protocol for trying to alleviate your plantar fasciosis. And we start with step 1, which we do for both plantar fasciitis and plantar fasciosis, is usually injection therapy if you're not currently running. Now, if you're currently running, I might give you a steroid pack to decrease it because I don't want to weaken the plantar fascia. But injection therapy with a steroid into the insertion of the plantar fascia is step 1. During that step, we also go with an over-the-counter arch support or a prefabricated arch support. Sometimes if you have a really messed up foot or one that, God had a sense of humor when he made it, we strap you up because an over-the-counter arch support won't really fit. We give you stretching exercises. We talk about the kinds of shoes that you wear. We give you a night splint because a night splint has been shown to work very well with dynamic stretching throughout the day and then static stretching at night. They work better together. And then lastly, we usually talk about what kinds of relative rest you should do, which means if you're going to boot camp, if you're standing on your feet all day, what do we need to do? We need to slow it down. I didn't say you had to stop, just take it down a notch. That's step 1, and that lasts for about 4 to 6 weeks. You know what? A lot of people get a lot better just with step 1. But 4 to 6 weeks later, you see you again and go, hey, let's go on to step 2. Step 2 depends on you. It depends on the symptoms. You might have a second steroid injection. You might go to physical therapy. We might make you a custom orthotic depending on how you did with the prefabricated. And we might do EPAT therapy. Extracorporeal pulse-activated technology will actually take you back to an acute inflammatory response. And we'll talk more about that for another video. Say that doesn't work, we do all of this stuff for 6 to 12 weeks, then we start talking about surgery. Well, the good news is 85% of people get better before we get to step 3, which would be either an open plantar fascial release or an endoscopic plantar fascial release. But we'll talk more about those another day too. The thing to remember is plantar fasciitis is not necessarily plantar fasciitis. It can be plantar fasciosis, and taken care of in a very stepwise fashion, 85% of people don't need surgery. So come on in, let us take a look, and stop waiting 4 to 6 months.